Are you dealing with somebody that has avoidant attachment? Or are you dealing with somebody that has borderline personality disorder? Borderlines often get confused for people with avoidant attachment, especially fearful avoidance. However, there are some very distinct differences. First, it's important to note, avoidant attachment is an insecure attachment style, and it is a learned behavior from childhood. But like any learned behavior, it can be unlearned and replaced with something else. Borderline personality disorder is a full-fledged personality disorder. It is a cluster B personality disorder, meaning it's a disorder that is with this person for life. The borderline can learn to regulate themselves and manage their behaviors, but the personality disorder will always be present. Now, there are some very distinct differences in the behaviors of a borderline versus somebody who is simply avoidantly attached. It's worth noting that not all borderlines have the same attachment style. Some will have an anxious attachment, some will have a dismissive avoidant attachment, and some will have a fearful avoidant attachment. Fearful avoidant attachment is the most common in someone with borderline personality disorder, meaning they have an anxious and an avoidant side. Borderlines typically had a very traumatic childhood. They had the emotional neglect factor from their parents or caretakers, but they also often experienced trauma, abuse, whether it's physical or mental. And this trauma, this emotional neglect, creates an intense fear of abandonment in the borderline. Insecure attachment in general is fueled by a fear of abandonment. However, that fear is so much more significant, so much more deep, and so much more pronounced in somebody with borderline personality disorder. And that fear of abandonment can affect everything they do in a relationship, regardless of whether they are acting in an anxious way or an avoidant way. Borderlines tend to be much more erratic with their behavior and much more impulsive than somebody that simply has insecure attachment. Borderlines are very prone to things like drinking binges, drug binges, gambling binges, spending all their money recklessly, and going through periods of time where they have a lot of partners in a very unsafe way. Now, this is a person that doesn't have a very good sense of self. Borderlines lack a sense of self, and they're constantly trying to figure out who they are, but they often try to figure out through external factors, trying to get that validation, to get that attention, to get that dopamine rush, to figure out who they are and feel better about themselves and try to find their sense of self. They can be very impulsive with risk-taking behaviors in general, because again, this is a person that has a lot of inner pain, and they're trying to mask that with dopamine rushes and things that provide dopamine rushes. Insecurely attached people can engage in external validation seeking, but it's usually not anywhere to the same extent that a person with borderline personality disorder does. People with avoidant attachment can love bomb, and not all of them do, but the ones that do it because they have all these bottled up emotions, and they've suppressed their emotions throughout their lives, but early in the relationship it feels safe and the dopamine is flowing, so they let all these bottled up emotions out onto their partner. However, they are being genuine in the moment. They're expressing what they really feel, want, and like. But when the avoidant has their fears triggered, they shut down and suppress all this stuff and push the partner away. A borderline will actually do something called mirroring early in a relationship. Subconsciously, they are very perceptive of their partner. They recognize the body language, the speech patterns, the facial expressions, and even the wants and interests of their partner, and they will mirror that back to them. They will actually chameleon, they will mimic the partner in a sense, and this can create a very intense chemistry early on. It can seem such a whirlwind. However, the borderline is really just projecting to this person what they think that their partner wants to see. They're not really being their true authentic self. They are simply trying to latch this person in to prevent the inevitable abandonment, well, inevitable in the mind of the borderline. Borderlines are also prone to something known as splitting. Things are either all good or they're all bad. Extreme black and white, all or nothing thinking, especially when it comes to their partner. Either all wonderful or all bad. Now, fearful avoidants can also do this to an extent, but it is much more extreme with the borderline. Now, a fearful avoidant during the course of the relationship can go from their anxious side to their avoidant side and back and forth depending on what trigger and what circumstances are present in the relationship. A borderline, however, will go back and forth much more quickly, sometimes even in the same day. Anxious in the morning, avoidant midday, and anxious minutes later. And it is a rapid swing back and forth, and it can be very confusing. This person's hot, well, now they're extremely cold. They're hot and cold. They're being clingy and loving, and now they're just stonewalling you and pushing you away. Now, fearful avoidants, they don't switch back and forth nearly as fast as a borderline. Especially once they've deactivated and gone into their avoidant side, it takes a fearful avoidant significantly more time to reactivate, re-engage, and get back to their anxious side. A borderline, they can do this and it can be within the same day or the next day, hot, cold to the extremes. Borderlines are unfortunately significantly more prone to self-harm. There's a lot of inner pain and they can really get wrapped up in it. And behaviors that are commonly associated with borderline personality disorder include cutting, suicide attempts, and other types of self-harm. Self-harm is not that common with somebody that simply has avoidant attachment, but it is unfortunately very common with a borderline. Borderlines can also discard partners just in the way that a narcissist and an avoidant can. Borderlines have this intense fear of abandonment, and if they suspect that their partner is inevitably going to abandon them, that it's going to happen, they can go into their avoidant mode and quickly discard a partner, breaking things off abruptly, showing no empathy, giving vague excuses and gaslighting and stonewalling just in the way that a narcissist or a severe avoidant can. It's a mode of self-preservation. When the borderline discards a partner, they're trying to protect themselves from what they perceive as inevitable abandonment. So it can be very difficult to determine whether you're dealing with somebody that's simply avoidantly attached and very insecure, or if you're dealing with somebody that has full-blown borderline personality disorder. But note, the behaviors are much more erratic in a borderline, much more impulsive, much more extreme, hot and cold at a rapid pace, and they are much more prone to self-harm and other self-sabotaging behaviors in general. But don't try to diagnose this person. It is up to licensed mental health professionals to give a diagnosis. Now, you can note these behaviors and think to yourself, okay, this might be the case, but it requires a professional to do the diagnosis. Borderlines, if they are not treated and if they are not even self-aware, can be extremely difficult people to be in relationships with. It is a roller coaster ride, hot and cold. One day they might be a loving partner. The next day they're telling you that they hate you. They're shutting down and pushing you away, gaslighting and stonewalling. It is a roller coaster ride. But if your partner, your ex, if they have borderline personality disorder, you are not responsible for these behaviors. You didn't cause this within them. You did not traumatize them in childhood. Unfortunately, this is something that is out of your control. So don't personalize their traumas. Don't personalize their personality disorder symptoms. Because if you personalize it, you're pushing yourself into anxious attachment and you are only creating yourself anxiety when it's not necessary. This is unfortunately not your doing, but you can have love and empathy for this person because it is a struggle to have this personality disorder.